Hello, everybody, and welcome to Gray Muzzle's monthly webinar series. My name is Dana, and I'm joined today by Amanda, both of us representing the Gray Muzzle team. For those of you who are new to Gray Muzzle, we are the largest national nonprofit focused specifically on the well-being of senior dogs. We work tirelessly to save the lives of at-risk seniors by providing crucial funding to animal welfare organizations across the country. And we're also equally as committed to helping pet parents keep their beloved senior dogs thriving inside their homes as well. As part of our dedication to serving senior dog lovers and advocates, we offer free webinars like this one every month. And today we are super excited to introduce our guest, Dr. Ernie Ward, an award-winning veterinarian and founder of the Association for Pet Obesity Prevention. Dr. Ward is also a Gray Muzzle Advisory Board member, internationally renowned speaker, entrepreneur, author, and media personality. He's here to share his expertise on a very important topic, which is healthy aging, addressing obesity in senior dogs. And during today's session, Dr. Ward will be providing us with the latest data on obesity in senior dogs and discussing the rising trend and explaining its implications, but also guiding us through recognizing what unhealthy body conditions look like and understanding the causes and consequences of excess weight, and also, most importantly, how we can take action to keep our senior dogs healthy and happy. So we're thrilled to have Dr. Ward with us again, and without further ado, let's get started, and I will shift the floor over to Dr. Ward now.
Oh gosh, thank you so much, Dana and Amanda, and thank you to the Gray Muzzle for once again, sort of highlighting a topic that's been near and dear to me throughout my professional career of the last 30 plus years. I've also been very honored to serve on the Gray Muzzle Advisory Board for many years, and it's remarkable. I just returned from China, where the World Small Animal Veterinary Association had its annual conference, and I was speaking with a group of Chinese veterinarians, and we were all talking about what are the things we do, and obviously it also talked about some of the charitable things that we were involved in. And I actually wound up meeting a couple of Chinese veterinarians who are establishing a very similar organization in China. And, it just goes to show you that our efforts here in the United States, and sometimes it even seems small and insignificant, they actually have broad repercussions around the world. And that's going to lead us to our discussion today on obesity, because it is an international global challenge that veterinarians and pet parents alike face. And so, as we sort of recognize that this is something that affects so many, what are the consequences? What are the causes? And how can we intervene and help our pets, our dogs, live longer lives? So today we're going to focus primarily on dogs. Obviously, the Association for Pet Obesity Prevention and the World Pet Obesity Association focus on dogs, cats, horses, rabbits, you name it. We focus on all the species that we share our homes with. But for us, we're going to focus today on the older dog and some of the things you need to learn. So if you have questions, definitely pop them over in the chat. We'll probably hold most until we get to the end of this, so I'd like to be able to take that. Also, if you're watching today, there's going to be a couple of requests we have for you. So again, you may be watching this live, you may be watching this recorded in the future, but we do need your help. So let's kind of talk about your help and what you can do. If you are a veterinarian, we need your help with our biennial prevalence surveys. So you guys are familiar with this data. You see them in advertisements, you see them in vet publications all the time. It's talking about, like 60% of dogs and cats have obesity or overweight in the United States. So that's our organization. And we need volunteer vet clinics to get that data, that prevalence data. So if you're a vet or if you have a vet, send them this link, send them this QR code, say sign up. It takes a couple of minutes to enter the data in when they're seeing regular appointments. If you're a pet parent, though, we want to hear your voice and opinion. And so each year we conduct a pet owner or pet parent survey on trends in nutrition and in obesity and all that sort of stuff. It takes about 5-10 minutes max. We do give away some prizes. So definitely go ahead and visit petobesityprevention.org. Sign up for our newsletter, which will automatically, you'll get all the information about the prevalence surveys, but you can also dig around and sign up for the prevalence survey if you want that. But if you are interested in this stuff, you might be very interested in our monthly newsletter. So again, October 7th through the 13th is World Pet Obesity Awareness Week, and so we hope that you will participate in some of our surveys. Those will open October 7th and run until the end of the year, so definitely help us out. Well, let's look at some of the last data. And 2022 was our last biennial United States prevalence. This year we are opening up internationally, so we have our surveys in French and Spanish and Portuguese, so we're really trying to now get a better idea of the global picture of pet obesity. But when we look at the numbers, it's about 60%, right? So about 59% of dogs, 61% of cats were classified by their veterinarian as overweight or have obesity. So this is a huge number. Again, the problem was that about a third of the pet owners with pets that were overweight or had obesity thought their pet was normal or even thin. So we know that there's a disconnect. We know there's a challenge in actually you identifying your pet's body condition. And so we do have tons of tools on the website, but again, we really want to make sure that people are able to understand that obesity is a disease. It's a chronic inflammatory state. You're going to hear me say this over and over again. I'm going to share with you tons of research on this topic, but the reality is, most of the time people just don't recognize it, right? Only about half of the people that responded in our last 2022 survey said my vet actually talks to me about what is a healthy or ideal body condition or weight. So we've got to do better, right? That's on me. That's the veterinary community. We've got to do better at communicating with you about this. Very, very important. Again, how do people try to lose weight with their dog and cat? They reduce the calories, which is often ineffective because then you get the protein out of balance, you get the fats out of balance. I mean, there's some really nuances to how we lose weight safely and effectively. Of course, they'll measure or weigh the food, which is fantastic. That's a great step. But again, in just reducing calories, that's not always going to be the end of it. And then exercise. And guys, I'm going to tell you right now, you can't exercise your way to an ideal body condition, right? It's very difficult to do that. If you're already starting from a place of obesity or overweight, you've got to do both. You've got to have exercise and diet. And, as I did in my very first book on this topic called Chow Hounds, which I think is now out of print. I'm not sure if the publisher did the second edition or not now, but you can still find it on Amazon and some of these places. But in 2009, we were talking about this, and I laid out, what's the science say about this? Was it exercise? Is it diet? What is it for people, right? And so for humans and dogs, weight loss, so again, going from an obesity state or an overweight state to a normal, healthy, ideal body condition, for humans and dogs, it's about 60 to 70% diet and about 30 to 40% exercise. I give a little bit of wiggle room there because there's a little slight differences between dogs and people and even sizes of dogs. So about 60 to 70% is the diet. For cats though, guys, are you ready to have your mind blown? It's about 90% diet. So you can see why when folks like me are out there, talking to cat owners in particular, it's like, it's all at the food bowl, guys. We've got to do a better job for sure. And again, most of the time vets say, I don't want to talk about this to people like you because you're going to be embarrassed. You're going to be upset with me for doing this. And yet when we've surveyed folks, we ask this question almost every year. I'm sure we'll ask it this year as well. So please let your opinion be known. But the vast majority of pet parents tell us, no, we want to know if our pet is at an unhealthy body condition, right? They're not going to be embarrassed or upset about that, okay? Now, if we do look at obesity, okay, so now when we look at obesity, those are the pets that are at risk for serious consequences. These are the dogs and the cats at risk for insulin resistance and diabetes. They're going to develop hypertension or high blood pressure. They may actually have osteoarthritis or complications from painful arthritis, right? I mean, the whole tons of problems, and we'll talk about that today. So about 22% of the dogs had obesity in our last survey. And of course, as you can see, my big concern was with cats because about a third of them. So we know it's a bigger problem. When you kind of look at some of the way we broke it down in 2022, and again, if you're a veterinary professional watching this whenever, if it's up until the end of 2024, please just take a day out and just record those body condition scores for the dogs and cats or horses and ponies that you see during the day. And you can see again that this is that number that we're so concerned about. And really, we got to do better because a normal, healthy body condition is the secret to longevity and quality of life for sure. Again, when we look at that underestimating, I talked about it, about 33% or so of pet owners didn't know. If we dive down deeper, it's actually the dog owners that have a harder time realizing or understanding or seeing that their dog or cat is at an unhealthy body condition, right? So this is really more of a problem with dogs. In fact, it's interesting interesting when we look at some of the survey results, the cat owners are like, yeah, I know my cat's fat, right? But dog owners don't tend to have that same reaction, right? I mean, they do in some extreme examples, but really 36% underestimated. So again, their veterinarian classified their dog as overweight or having obesity, and 36% of those dog owners said, no, my dog is a healthy body condition. So we got to do better than that for sure. Again, just talking about, are you embarrassed about this topic? Do you want to talk about it with your vet? And the vast majority say, look, we want to be told about it, right? So 2/3 of our respondents in 2022. And again, that's why we need your voice, because we want to hear from you. Because if suddenly now this next year, this flips and people say, oh my gosh, I'm totally embarrassed about this, I don't want to hear about body condition in my dog or cat, then we've got to change the way we communicate that with you. Some of we asked for comments on some of these questions so people can tell us how they feel about it. Again, you can see that most of the time, the vets, they either do a good job or they really ignore it for sure, right? And so you can see the discordant responses. And so we want to do better for sure. And look, my son-in-law is a vet doctor and tells me people get offended and don't consider their pet overweight when they are. Part of that's true, part of that's not true, but all of this builds up barriers to communication, and we want to do better. Again, when it comes to helping their pet lose weight, dog owners are the winners, clear winners. In fact, over 73% in our 2022 survey said they had helped or tried to help their dog lose weight at some period of time during the past 2 years. So for us, we're really, focused. This is great news. Now, unfortunately, they're not super successful at it. As you can see, dog owners only about 35% or half of those folks said, yeah, it worked. But again, we can do better. Now, cat owners, it's much more complicated to lose weight in a cat. But you can kind of see here, and all of this is on the website. If you go to petobesityprevention.org down here, and again, sign up for our newsletter so you can be involved with these surveys. But all this data is out there if you just go to the survey results areas for sure. Again, how do they help dogs? We talked about this before, but they gave smaller portions. They reduced the calories, right? They stopped treats. That's how most people actually try to manage obesity. And sadly, it's just not going to give you the results. You've really got to change the macronutrient composition, the nutritional density of these foods, because we know from study after study that most dogs respond better to a higher protein, higher fiber diet when it comes to losing weight safely and effectively. So again, you can kind of look at this. Now, why should you care, right? I mean, why is this an issue? And I try to tell people that obesity is not a disease of fatness, right? This is an inflammatory state. This is something that is causing illness throughout the body. It is a disease. And some of the things that we have clear evidence on, and I was one of the co-authors of the original American Animal Hospital Association report or guidelines for obesity and weight management. We know, and we'll share with the studies, reduced life expectancy and reduced quality of life. A whole host of skin conditions are directly related, caused by obesity. And one of the reasons, guys, is because of that inflammatory state. Right now, we're doing studies where we look at the levels of leptin. Leptin is one of those inflammatory markers that we see with obesity. It goes through the roof in the skin, which causes inflammation. So a lot of these older dogs that have obesity, they have chronic dermatitis. And guess what happens? We get the weight off, they return to a normal, healthy body condition, skin problems improve. It's kind of remarkable, but people need to know. Of course, no surprise, orthopedic disease, hips, shoulders, elbows, really lots of problems there. Cancer, metabolic and endocrine disorders. Of course, things like thyroid disease can cause weight gain. Kidney, respiratory, and of course, chronic inflammation. All those things are expected. So let's talk a little bit about there have been 2 lifetime studies done in dogs. So they took dogs from puppyhood till death, and they tracked everything they could about them, right? And so the big benchmark study that brought this all to light was done by Purina. And so this study kind of just validated what most of us were thinking, right? And it was an extraordinary, elegantly designed study, just incredible. And again, it was originally published back in 2002, but this has been going on now for like 15 years prior to that. So it's amazing. They wound up studying 48 lab dogs. And again, all this stuff you can find online or links within the website at Pet Obesity Prevention. But basically they said, look, let's take and split them up. Let's feed half of them whatever they want to eat, okay? So just like most folks feed their dog, like, hey, hey, you want to eat some more? Here's a little more, right? And so they took the others and they said, whatever that group is eating, we're going to reduce it by 25%. So that group would always match up, but because they wanted to also look at thermic changes. So like if it's cold or hot or seasonality or age, right? So they said, you know what, this group, whatever they want to eat, we're going to knock the other group down by 25% and see what happens. And of course, over the years, tremendous changes. Probably the thing that most people are familiar with, but we're going to get into some of the other interesting stuff, is the fact that those dogs that were fed 25% less lived to almost 2 years longer. Now, this was later duplicated in another study by Waltham. So this other group said, hey, we want to match this. We want to see if we can actually duplicate and reproduce those findings. And they found almost identical findings across the board. But you can see here, we got a 1.8 year difference. And if in people terms, again, that's a 16% difference. But in people terms, if you took the average life expectancy of 78.7, that meant you got up to 91. And that's what I try to impress upon people. It's like, okay, what if I told you, here's an easy way for you to get another, 11, 12, 15 years on your life? Most people would say yes. And here's the kicker. It was better quality of life. Less disease, okay? So if we start to look at this stuff for sure, it gets even more interesting. And this is some of the stuff that folks don't talk about a lot. And again, all this is on the website, so definitely if you dig around, you'll find out all this stuff. These slides, I think, are all up there as well. Or a lot of them are up there for sure. But here's the thing. That group that got to eat what they wanted to eat, only 4% of them were alive at 13 years of age. Remember, that was that next kicker, right? That was the average. And so 50% of those fed 25% less were still alive. This slide is the one that I wish everybody had reported on, because I think it got really lost in the averaging, the way we do data analysis. The impact of this slide is quite phenomenal, right? All these guys on this side are gone, and these are still alive, right? I mean, that is remarkable, because to me, I'm like, wow, how do we get them? Well, now, if you dig in even deeper and you start looking at when they were euthanized and what kind of conditions and all that stuff, look at this one right here. I love this one right here, because everybody reports the median, right? But look at this. What age did they get sick? Something that required medication. And almost all of these were osteoarthritis, okay? What age? It was about 10 years for the regular fed, you eat what you want, we feed you like most Americans feed their dog, and 12 years for those fed just a little less. Now think about that. That is dramatic difference. I mean, 2 years of high quality life. That's what that tells me, right? And be clear, these were in a research setting. As soon as those dogs showed any clinical symptomology or signs, they were like, we got to get them on some medication. We got to investigate. We got to figure out what's going on for sure. And again, euthanasia, all that stuff. The oldest dog in the normal cohort, normal fed, was 13.29, and the oldest was 14.5. So again, this is just one of those things that I just want to focus on. And here, I love this. 9 of the 24. Remember, they split them in half. 48. 9 of the 24 calorically restricted dogs were still alive after all of the regular fed dogs were dead. I mean, that is the message I wish everybody could get for sure. And again, so another study for sure looking at genetics, and this was sort of saying, how can we do this? Cancer was the big thing. 5 restricted calorie with 6 control. Again, the restricted calorie dogs were euthanized an average of 11.6, while the other control group fed what they normally would have fed at 10. Again, study after study. These are dogs that have similar genetics, right? So these are researched animals. And while I don't like that, I mean, I appreciate the value of this important. And again, so here we go. Cancer is related to it, and obviously we need bigger studies, and the authors, and I'm quick to point out, a lot of these are small studies, because when they look at dogs over their entire life, these are expensive. I mean, you got to house them and have people to take care of them and all that stuff, and very controlled, and there are strict regulations around this. So I appreciate that. One of my good friends, Alex German from Liverpool in the UK, and we do a lot of work. He was one of our board members for many years at Pet Obesity Prevention. But he did a study back about 10 years ago now, I guess it's 12 years now, where he looked at, okay, how much weight does a dog have to lose before we see demonstrable reportable improvements in the quality of life. This is you as a pet parent. You're saying, my dog is feeling better. My dog's quality of life has improved. What was that number? Because a lot of us had struggled. A lot of us were doing this, and we would see some patients that the owners would say, he's like a puppy again, and they only lost like 4 or 5 pounds. We're like, I don't get that. Maybe this is placebo effect type of thing going on. Maybe this is a person with wishful thinking, right? And then we'd see other dogs that, they lost 10 or 15 pounds. They lost 10% of their body mass, and the owner's still complaining. So we're like, what is up with this? And so one of the things that Alex concluded in his studies done in the university with pet owners, right, with people like you coming in, that once you got to around a 6% weight loss, that is when people reported improvements in quality of life. And this is a validated scale. I mean, if you ever look at some of these QOL scales online, I mean, most of them have been very thoroughly vetted and validated and qualified. And so for him, he would ask a series of simple questions. People would do assessments at home and say, is my dog now able to go up the stairs? Is my dog now able to get in the car? Is my dog able to go for a walk? If so, how long? Do they seem winded? Do they seem painful? Whatever, all those things that matched up with quality of life. And it doesn't take that much. And this is one of those things that you should really be encouraged by, because if you're struggling, if you have a dog right now, an older dog that needs to lose weight, all right, it, your vet hopefully has told you about it, you're going to improve its quality of life with just a minor amount of weight loss. I mean, 3, 4, 5 pounds can make all the difference in the world into how that pet feels. And one of the things too, that if you're watching closely as folks like us in this space do, with what's happened with some of the drugs, the GLP-1s on the human side, those are matching up and tracking perfectly with this. People are reporting significant improvements in their own quality of life after losing that first little rash of weight, right? So they go on Wegovy, they go on Ozempic, they lose that first 10, 15, 20 pounds maybe, and suddenly they're going, oh my gosh, I feel like a new person. And guys, I have to think that our dogs feel a lot the same way, for sure. I do want to talk just briefly about some of these other conditions. We talked about insulin resistance, and we talked about diabetes and related to obesity. And I don't want to bore you, because this is actually just talking about how insulin is. And a lot of times, I'm lecturing to veterinary colleagues about this. And, it's always good to remember how glycogen is stored. That's the storable form of glucose in the body. And so when we're looking at how all of this works and what it does, we kind of start to say, okay, look, if a dog has obesity, if they are really starting to gain weight, body fat, okay, this is when we start to damage and alter the insulin receptors, okay, and primarily these are going to be in the pancreas, but there's actually, tons of research and evidence, of course, in both animal models and human models, but basically when these insulin receptors are decreased, that is when your body, again, is desperately secreting more and more insulin, trying to do this, and this is where we start to get into high blood sugar. And when you hear us talk about insulin resistance, which is quite arguably the more important of the two with dogs, right? Many of these dogs with obesity don't go into full-blown diabetes, but they are in insulin resistance, which again means their body's pumping out tons of insulin, and that is causing tremendous damage to a wide variety of organs. So when you hear vets and physicians say, I'm most worried about your insulin resistance. And again, this even goes back to pre-diabetes definition in human medicine. That's why we are so worried, because we know that excess insulin is damaging everything in your body, including even brain and cardiac tissue. I mean, this is not just isolated to simple things. Now, eventually, the pancreas will stop. I mean, it can't. The beta cells are no longer able to produce insulin. I mean, we do sort of see that. And that is when we actually get into diabetes. But most dogs, most senior dogs out there, when I start running some of these, certainly homocysteine levels, we look at, when we look at hemoglobin A1Cs, when we look at fructosamines, right? And all those amines, we start to see, wow, these dogs are high, they don't have diabetes yet, but they are insulin resistance, which again breaks my heart. Again, just kind of getting into how now insulin resistance leads to diabetes, and these receptors again. And you'll notice too, a lot of this GLUT4, what you're about to see also in the human world is, remember the GLP-1s right now kind of, they've targeted one pathway. There are multiple pathways to help with appetite suppression and with insulin regulation. Remember, the GLP-1s were originally designed to help with insulin hyperinsulinemia, right? So we know now that as this next generation of GLPs, and we're calling them GLPs and they're really not, but they have multi-target receptor, they do multiple target pathways. Guys, it's unbelievable about what's to happen. So again, old research here from '05. This is kind of considered one of the foundational papers, but basically they looked at dogs with obesity that had insulin levels, and they measured them. And so dogs with obesity had twice the circulating levels of blood insulin as lean, healthy weight dogs. I mean, again, I don't know how much research we have to have. Everybody knows this. The relationship, though, between that hyperinsulin state, obesity, and longevity, again, all of this is intertwined. If you go back even to 2003, this is over 20 years ago. People were looking at this from a research standpoint, and basically was the more sensitive a dog was to insulin, as opposed to the obese dog's lack of response, the longer it lived. So again, insulin resistance has been linked in all animal models, including canine and humans, to decrease longevity. I mean, you just can't live a long time when you're insulin resistant. Let's talk about the three main hypotheses and theories of how obesity causes cancer. And I'm going to kind of stick with the three that we have the most evidence for dogs for today. There are multiple other theories out there. There are some really, I believe, some evolving evidence that's going to even point to some more elaborate pathways. But in simplest terms, obesity in dogs causes cancer in one of three ways that we fully understand. Number one is it creates extra estrogen. Remember, those fat tissue, that fat cell is pumping out a whole variety of hormones, chemicals, compounds, 24/7. This is why we call that excess fat in your body the second pancreas. It's that endocrinologically or hormonally active. And so by producing excess estrogens, we do increase the risk, even of male dogs, of developing cancers. And this is one of the reasons why you see in human males with obesity, they're actually, if you've probably read the reports, breast cancer is just, elevated. It's really frightening and sad, right? So again, estrogen is going to be secreted, male or female, from fat tissue, and that of course sets you up at risk for other conditions. And it's really remarkable. I think, one of the reasons that we don't see quite as much in dogs is because, again, they're spayed and neutered early on. So that does give us a head start on this, but we're still seeing breast cancer now in dogs with obesity, all right? We talked about insulin and growth factors. So there are a whole variety of insulin-like growth factors. So you hear about insulin-like growth factor 1 as being, indicted in a lot of cancers. And so again, that hyperinsulinemic state that we referred to earlier, that also drives a cancer risk. And of course, just plain old-fashioned inflammation. The macrophages are responsible for trying to reduce this. They're going to have increased damage to, the RNA, DNA of these cells, the mRNA, the messengers that are telling how to make a new cell. And so anytime that pathway is disrupted or damaged, your increase of cancer goes up. So you kind of get that. Well, what about arthritis? Well, there's really two main competing and really I would say coincidental theories. Number one is the wear and tear hypothesis, but I've got to be careful because a lot of times I hear this in the media. I just heard it on the Today Show misstated by an orthopedist. And so, when we say wear and tear, remember there's typically a biomechanical damage. There's an alteration in the joint mechanics, right, that inside it. So when we say wear and tear, we don't just mean you wear out your joint. We mean that the excess loading factors cause damage to the cartilage or support structures, subchondral bone around that joint, leading to instability that then accelerates the changes in that subchondral bone. So again, that sounds kind of silly, but the reality is the wear and tear isn't just that it wears out, it's actually that this excess load caused by obesity then causes damage, and then you have biomechanical alterations to how that joint should have functioned, right? And of course, there are some genetics as well. In fact, one of the things we're looking at in dogs, older dogs in particular, is the relationship between cranial cruciate ligament injuries, the CCLs, that we all know about with our large dogs. That does appear to have a strong degree of genetic predisposition. So a whole nother issue. But then, of course, we talked about injuries and then non-weight bearing joints. This is where inflammation kicks in. So when you've got obesity, You have a chronic inflammatory state. That's what's causing damage to those joints. And this is why lots of people with obesity complain about, they have all types of problems with joints in their hands, right? And their feet and, and even their neck. And so these are not typically weight bearing in the traditional sense of, how your hips and knees and even shoulders and elbows work. But for us, we're looking at, wow, that's that chronic inflammation. Again, those inflammatory mediators are the adipokines, the adipocytokines, cytokines. Again, we talked about leptin in the skin, adiponectin. There's also a great study not too long ago in dogs looking at adiponectin levels of dogs with obesity. And that was done by, I think that came out of Brazil. I believe that was a Brazilian study. Fantastic, really interesting. And again, kind of retinal binding and tumor necrosis factor alpha, those are for sure. Again, when we look at sort of what else goes on, tons and tons of research. And here's the thing, when you do get that excess body fat off, these inflammatory mediators drop. And this is one that looked at leptin, and actually that study that looked at leptin levels in the obesity in the skin of dogs with obesity, they also saw a drop, a corresponding drop as weight loss. So the great news is you improve a lot of these diseases, right? Now, once the damage is done to that subchondral bone, we can't really repair that unless we do a joint replacement. And that's why you have to have a hip replacement, for example, or a knee replacement. But you can help prevent that damage by reducing the body fat for sure. Again, lots of words on this, lots of stuff for vets, but these same inflammatory mediators are the things that are going to cause damage throughout the body, and actually it's kind of interesting because now they're looking at leptin, adiponectin in particular, and brain and just how that affects certain forms of dementia and cognitive decline. So it's quite fascinating. So I just want to kind of give you a lot of the science. Again, I know there's a lot of folks out there that are very smart and very interested in this topic. So I gave you a little brief foray into that, but I do want to talk about some of the things we can do. I want us to, though, leave this section understanding that obesity is a chronic inflammatory disease. It is not a condition of fatness. This is not an aesthetic issue. This is simply a disease state, and we have to take it as such, right? Without a doubt, this is our pets, our dogs' most dangerous health threat. Why? Because it affects so many. And even different than like periodontal disease, which is another real problem, especially in older dogs, this thing doesn't get better, right? You have to do work. The great news is you can improve this, and we'll talk about some of the ways to do that in just a second. But this, of all the things, if I had the magic wand, this is the one thing I would do. I would say, hey, let's take this seriously as a disease. It's chronic inflammatory state. And now let's get serious about reducing the excess body fat. We don't chase a number on the scale. This is not a disease of fatness. This is actually a disease of something that we've got to get rid of, a particular type of tissue that's storing excess energy in the body. Again, reducing chronic inflammation. That's our goal. All right, so how do we do that? Back in the early 2000s, like a lot of folks, and I was kind of forward in doing a lot of this stuff with obesity at that time because it wasn't really a hot topic back then for a lot of reasons. And, I quickly realized that you couldn't just say, okay, let's calculate the number of calories that the dog or cat should be eating, and let's just start feeding it there. Because two things happen. Number one, as you can imagine, these pets went into mutiny. They revolted. The dog said, no way, I'm going to make your life a living you-know-what if you try to cut my food like that, right? So there's a lot of behavioral problems. I call it pestering, right? I mean, begging behaviors. You guys know the picture. So if you just try to say, here we go, here's your new feeding amount, these people are going to revolt and your life's going to be miserable, okay? The other thing is there are metabolic plateaus. Now, I had come from a world of ultra endurance athletics, as a personal trainer, as an Ironman coach, and of course did all those things. And so I had already been very familiar with how we have physiological metabolic adaptations in humans, but no one was really applying that concept in the vet world. And so again, dial back to 2000, and as silly as it may seem, that just wasn't a thing. And I'll be honest with you, to this day, you're probably still talking about maybe 25% of the vets actually look at this from a physiological perspective. And so what I discovered very early during my, when I really started switching, I had a special clinic that we devoted to behavior and obesity, right? So I opened this new clinic and I said, this is where we're going to focus. And we had all the treadmills and all the rehab stuff. It was fun. I loved it. But I said, we're going to have to be more strategic. And so we started doing what I call the step weight loss. And that was primarily to avoid a lot of the begging and pestering behaviors that dogs would exhibit, right? Because if you crash their calories, they go nuts, and I don't blame them, okay? Because again, weight loss is not about starvation or deprivation, right? It's about a very safe, controlled reduction in calories to reduce fat. So again, let's be smarter about this. So we started doing different things. And so if you're out there today, you can definitely go on the website. We got tons of this stuff written up, and we give little calculators and yada, yada, yada. But I want you, the next time your vet does this, say, are you doing a step weight loss program for my dog, right? I know Dr. Ward is a big fan of that. It's in all my books. I've published numerous papers, written textbook chapters about this. I mean, this is not something unknown out there. And if you will approach it like this, you're going to have better success, and your dog is actually going to be happier throughout the period. Now, the criticism of this is it can take longer. I totally get that. I mean, I could be adding an additional, 30% longer time. So instead of like you crashing a dog and getting the weight off in 3 months, I might say it may take 4, 5, or 6 months. But I'm willing to take it out a little longer if my dog is happier. So again, I'm going to take it a little more gradual. I'm going to be very methodical. Now, the most important thing I want to tell you today, and you need to write this down, you need to just, when you go into your vet, you need to just print this out and say, this is what Dr. Ward said. No matter what diet, no matter what approach you adopt, I don't care what food you feed, I don't care how much, I don't wear any of that stuff. But after 3 months, if you are not seeing an appreciable, demonstrable, expected amount of weight loss, like these little steps are, if at 3 months, change your approach radically. So if you were on brand A, go to brand Z. If you were feeding 80% of what we call resting energy requirements, go to 70%, right? If you're feeding a high protein diet, go to a low protein diet. And the reason I say you got to go to the almost the extremes is because you're trying to figure out what your dog's unique physiology demands. And I can tell you that the most frustrating thing that I see is this poor dog that has been on some expensive diet food for a year and they haven't lost any weight. And heck, they might have even gained weight. And everybody's frustrated, everybody's blaming, and it's just like, why do we continue with this diet? Let's try something completely different. So whatever you do, just do the 3-month rule. In 3 months, if we don't see improvements, and I have so many patients that will get through the first 2 steps and man, they lost 5, 6, 8, 10 pounds, right? Everything's good. And then they get to that 3rd step and they plateau. And physiologically, the body said, I got you. I figured you out. This high protein thing, I can work with this. Yeah, just bring it on, right? And I've got to switch it up, right? I've got to change my nutritional approach. So don't be afraid to change. Do not get locked into one brand. And if you have a veterinarian that tries to lock you into that one food, you got to have a real conversation. Okay, you got to really do it. So again, when we look at those weights and those targets, what can you do for dogs? You can easily lose 3 to 5% of the current body weight per month. So you can see, going back to Dr. German's research, 6% was kind of where people started seeing feel better. That's why that first step is so important to me. And man, I'll tell you, there are people that I'll see their dog like, a couple of months into that first step and they're like, yeah, it's just not working for Buster. He's actually up a pound. I'll say, let's switch now, right? Because I know that if I can get to that 6% roughly, if I can get to that first little plateau, then they're going to feel better. The owner's going to say, hey, we're winning here, and they're going to more likely to continue with it. So you got to get out of the gate. You got to get that little bit of drop, and then you're going to see tremendous improvement in your dog. What does it look like for most? I mean, it's different, but I tell most of my clients, because again, usually we're dealing with obesity. So now we're at the far edges. They're 30+% body fat. So I've got to get a lot off. I'm saying, look, this is easily going to be 6, 9, 12 months, and I need you to stay the course. This is not always going to go like this, right? We're going to have periods where it's going to go up and down, but we have to be strategic. We have to stay in constant communication. We're going to do everything we can to support you, and we're going to get through this because we can get through this. This is not an unachievable goal, except for in some extreme examples of dogs that have concurrent serious diseases, cardiovascular disease, right? Or some crippling arthritis. But even then I can do a lot of good. So If I'm looking at that step, I just tell folks, look, let's start to divide, each of those steps into 1 to 3 months and kind of work it out. But again, we have all these tools on the line. Here's just an example of sort of what we do. Starting weight, and then this is a classic. This is like a 6-month weight loss for most older dogs. This is where I'm going to start right here. Again, there's a lot of math in there. All this stuff is online. I would encourage you to work with your vet. I would not want you to do this on your own because, again, the secret sauce to this is figuring out the macronutrients, right? So figuring out the actual composition, how much protein, how much fiber, how much fat, how much carbohydrates, and then we've got to supplement omega-3s and lots of other things, right? I'm going to be adding in L-carnitine in most instances, right? So there's a lot more to it than just feeding less. Also, I recommend that you have your dog reweighed at least every 3 months. Why 3 months? Because getting back to my 3-month rule, that's when we're going to say, stop. It's not working, we're switching. Now, there are many cases that we'll ask them to come in monthly for reweighs, but let me give you a little secret. I have most of my folks weigh them at home, right? So these like 1 month, 2 month rechecks, I teach them, you hold up your dog. Now, if they have a large dog or the person physically can't do it, then that's another issue. But most clients are able to weigh their dog at home. And a lot of vets criticize me. I've been saying this, for 20, 30 years. And it's like, oh, but that's not, you can't, how can you know if it's accurate or not? I don't care. I'm looking at the trend. I assume they're going to kind of do about the same thing. And so, it's like your scale at home may be different than the scale at your doctor's office. That's okay. But if you're weighing yourself every day on your scales, you're seeing if you're going up or you're going down. The absolute number is not the issue here. It's the trend. And so I get a lot of value out of that. I say, just text me, email us your 1 month, your 2 month. We'll see you at 3 month. And honestly, if I see a gap between 1 and 2, a loss, a good gap, not a weight gain gap, then I'm like going, this person's doing great, and we're going to celebrate that. But I think it can be sometimes a bit excessive to ask folks to keep coming back in. If it's convenient, if it's easy, if your dog likes going to the vet to get weighed, by all means do it. But for many cases, that 3 month is when I'm actually going to make a change, right? So I'm not, at 1 month, I'm probably not going to do anything except for in certain situations. What about exercise? There's no hard, fast rule. As we mentioned, it's only about 30 to 40% of the equation. So if I'm going to focus my efforts in one area, it's going to be on precise feeding, right? Getting the calories right, getting the macronutrient blend right. But in general, your dog should have 30 minutes of walking a day. I tell people don't beat yourself up over this one because this isn't going to make the difference. The reason we walk our dogs, the reason that you should engage in physical activity every day is also for your mental well-being, right? There's so many more positive benefits to daily physical activity than just weight loss. In fact, I don't do what I do for weight loss. I do them in order to maintain my abilities, my functionalities. I mean, I'm turned 58 here in just a few weeks. And for me, I want to make sure that I have the vitality, energy, vigor that I want to be able to do the things that I enjoy. And so that's how I look at it for dogs, right? Intervals, agility, all that stuff is great. But again, if your dog has obesity, you're probably putting at risk for damaging a joint, which is then going to delay and prolong a weight loss journey for sure. I love swimming. I love it personally. My dogs love swimming. I think that's a great no load type of activity. So if you do have access to swimming, that's fantastic for sure. Activity monitors, listen, tons of studies have been done to look at how accurate they are, and they vary widely. So I'd say, really, we're not quite there yet. There are a few, veterinarian grade, and there's actually a new product that's in the final stages that do show some promise. But for right now, the typical little accelerometer that you put on the collar, I think it's lacking. So I don't really get big into that. I do like food puzzles. Why? Because that can again change the entire atmosphere around eating, right? So we want to sort of make the dog enjoy it. So there's a lot of positive reasons to feed your dog with a food puzzle. I always feed my dogs and cats with food puzzles. And so, I think that that's just a part of the mental well-being. Having said that, you can also make less food look like and feel like a lot more. So I'm not oblivious to the fact that, less food sprinkled throughout a food puzzle and making your dog work for it can sometimes be satisfying as well. Food puzzles are highly effective for cats. And so, I've written a lot about that. If you struggle with it though, I do recommend some of the automated feeders. Like if you really have a hard time dispensing the right amount, And these guys all have shortcomings, right? They're usually volumetric in their disposal instead of like weighing, although there are some that are out there, primarily in Asia, that do use a mass or weighing process for it. But the reason I like automated feeders is because it sort of takes you one step away. And so if you're that kind of person who's likely to give that little bit of extra, then, this can help curtail some of those behaviors. Interestingly, we did, golly, this goes back to 2006. We did a study where we took the top 5 dog and cat foods, kibble, dry kibble out there. And I don't want to get into an argument on that right now. But we took the most popular dog and cat foods in America. And we wanted to see how much you could overfeed every day to gain a pound a year. Now in a cat, that's 10% of their weight, right? In a small dog, so we said 22 or 10 kilogram, 22 pounds and below dogs and cats. How much would you have to feed extra to gain a pound over a year, which I think is significant? Turned out it's about 10 kibbles extra a day for dogs under 10 kilograms, 22 pounds, and cats equals 1 pound of weight gain a year. So this precision in feeding, it becomes really paramount, right? Because at the end of the day, if you're overfeeding by 10 little baby kibbles, then, at the end of the year, your dog's going to have gained a pound for sure. Lots of games and so forth. Canned versus dried, whoops, sorry. Let me go back to that. People always ask me this, which is better? For weight loss, without a doubt, canned food is going to be your friend. Why? It has nothing to do with how it's produced, the processing, has nothing to do with the fat and calories and all that. It has to do with controlling the calories, right? So when you open that can, you have a set finite amount of calories to feed. Whereas when you pour kibble, you can overdo it by 5 or 10. So there are much lower thresholds for error with canned foods. So a lot of times you'll hear vets like me who are really trying to help a dog or cat lose weight. You'll see us kind of steer you towards canned foods. Now, one of the great things is some of these fresh food manufacturers even take it another level, right? They actually, based on your dog, and so I'm thinking like companies like Farmer's Dog out there. I mean, they have, 3 boarded vet nutritionists and, they've got all these formulas and they're like, hey, where's your dog's weight? And look, they believe in the step weight loss plan just like me. And so, they can kind of tailor that. So I do like some of the companies being more forward and progressive out there for sure. But again, in general terms, all foods are going to help you. You got to play with the macronutrients, but you got to get the calories right. And that's where canned food can sometimes be your friend for sure. But again, if you want to weigh the food, oh my gosh, you're my best friend and we're going to have a lot of fun together, okay? Now the art, should you feed less or change diet? If your dog needs to lose weight, needs to lose excess fat, you need to change the formulation. It's just that simple. Because when you reduce the calories, and let's say that you wind up reducing the calories by 20-25%, well, you're also reducing all of the vitamins and minerals contained within that food. Now, that means you're putting your dog at risk for deficiencies in potassium, and calcium, right? And all of the different electrolytes, and minerals. These are things that you can get out of whack quickly. And we see this a lot. When people just feed less, we wind up seeing orthopedic problems, right? We wind up seeing other problems, even with kidneys. And so I don't recommend just feeding less because we can be more sophisticated. We have clear science on this stuff. So there's some wonderful formulations out there that you should definitely do this. And even if you want to prepare your own meals, again, what you're going to do is keep the micronutrients, the vitamins, minerals, the omega-3s, all the fats, all the essential items. You're going to keep those constant and you're going to reduce the calories primarily through adjusting fats and carbs, right? So, this is one of the, it's hard to do at home, but there are so many elegant solutions out there. You also need to make sure that you're feeding your pets separately. So many older dogs in particular, there's a food bowl bully, right? There's a dog that sort of even puts pressure, subtle pressure on another dog to undereat or to overeat or to eat rapidly. And so, a good friend of mine from Hungary did this research it's probably now 15 years ago, and he called it the zone of ownership. And he actually went back and did a lot of studies in wild canids, right, and even wolves. And he found that, they actually space themselves out about 18 inches, right? And so that zone of ownership actually has to do with anywhere I can reach my head, that's mine. And he found that when dogs in home environments were fed in close proximity, these types of pressures became evident, right? Dominance and hierarchy and just all those different things that can appear when there's food problems in the home. So for us, we want to make sure that we feed them separately. I tell you, if you have a dog with obesity and another dog with a normal weight, feed them in separate rooms, right? Let's just take that out of the equation. The other thing is timed feedings really do also help us. So we're going to train our dog to say this period of time is when we eat. If you leave out an all-day buffet, you're never going to beat this problem, right? So for us, it's a matter of saying, look, here's our food. Here's when we're going to eat it. Here's where we're going to eat it. You're going to be in a safe place, without any distractions or intimidations. And we're going to now, that's 15 minutes later, we're going to pull it up. And dogs and cats can both can do that. Food and activity logs. This is something I'm going to put you to do because we're going to actually measure that. I do need that. And I'll tell you right now, I used to say this for my coaching back, whether I was coaching, Ironman or just somebody who wanted to improve in the gym, or a person helping their dog or cat lose weight. I can tell you who's going to succeed after 1 week by the quality of the log that they turn in, right? Because the people that see this as arduous, as a waste of time, as something that's beneath them, they are not going to have the focus to sustain a prolonged campaign for themselves or for their pet. And so the people, though, that actually go, all right, it seems a little junky to me, but I'm going to fill out this thing. Okay, we walked for 10 minutes. I fed half a can, whatever it might be. The people actually complete those logs. I have so much more confidence in completing this long term because, and again, we don't have to do this for months and months and months, but I need a good idea of where we are the first 2 to 3 months. Remember we talked about that first step. That's what I'm going to be evaluating because I'm going to actually look at that. I'm going to look at a lot of data, not just weight and body condition at that 3 months, but I'm going to look at everything that you give me, all the information I have, and then we're going to say, we have to change complete approach here, right? We have to change things, right? And again, consider all options. Don't just get locked into that one weight loss food brand, right? Consider all your options, and including, we mentioned some of the pre-portion options that are becoming readily available. I do also, in the last couple of minutes here, you do for all dogs, all senior dogs in particular, this is what you need to focus on. I'm going to focus on the ones that have to do with obesity, and you probably want to take a picture of this slide because not a lot of vets are actually doing all these tests, but they're all available at all the commercial labs in the United States and abroad. And so basically, every year, especially senior dogs, even twice a year, a CBC, a good chem panel, and a urinalysis. Right? And I'll tell you, if you don't do anything else, please do a urinalysis on your older dog. We call it liquid gold for a reason because it is golden in the information and data that it stores. So for us, I need that urinalysis for sure. But I'm also going to ask you to do an SDMA for kidney function. I think, again, we're now at the level of progress where this is such importance and elevation that we love this. I also, if the dog has obesity, I'm going to be looking at cortisol levels, so urine cortisol, creatinine levels. So you can actually go back to your urine sample, have a UCCR test done, inexpensive, easy, and that gives me some idea if there's an endocrinological or hormonal imbalance going on. Also, thyroid panel. And back in the day, guys, the total thyroid was what we had. And then we got a little more sophisticated and we got a free T4. That's great. And that's really what I use. That's kind of my benchmark. But we also need to consider TSH because we're at that level today where these are readily available. In fact, there is a great Zomedica actually has an in-clinic, like your vet can have a little machine about this big that actually measures all of this, including cortisol. So it's like, today, it's like there's no excuse to not do these things, right? I mentioned earlier about insulin resistance. So when I have a dog with obesity, I typically run what I call an insulin panel, which is going to be looking at typically fructosamine in particular. There's a couple others that we have on there, and an HA1C, right? So hemoglobin, HA1C, as you're all familiar with, for diabetes and prediabetes. So that is something that I look at really hard to say, oh, wow, and I'll tell you what's interesting about these levels is the fact that these are things that we will see trend down as body fat goes down. Now, having said that, I also am a huge fan of C-reactive protein. There are validated measurements for this in dogs now, so all the major labs run it. It's an incredibly valuable indicator of systemic inflammation, so I'm running CRPs on everybody. If you're watching today, if you're an adult, you should probably be watching your CRPs as well. And then some of the other things that are coming and are here, but they're a little more specific, so I'm not going to say you got to do it. But leptin, adiponectin levels, those are key indicators. Leptin tracks closely with body fat percentage. In fact, in humans, we can tell you with a high degree of precision what your body fat is based on your leptin level. So this is something that folks like me, we like to look at it, right? Interleukins, these are things that are now starting to look at inflammation and cancer risk, even in some instances. And there's a whole variety of new microRNA tests. And you've probably heard about these for cancer screening. And so what we're understanding is that a lot of times in certain cells, when they become abnormal, if we can track that RNA signal from that cell, we can actually detect a lot of diseases. So there's a tons of microRNAs that are coming online, specifically looking at insulin resistance and diabetes, cancers. I mean, this is really an area of super importance. So I want to kind of wrap up so we have time for a few questions. Again, if you're a pet owner, go to the website, there's tons of information, hopefully it'll answer most of your questions. Sign up for our newsletter, sign up for our survey for sure. If you're a vet clinic, there's a QR code, or you can go to the website and just click on the veterinary clinic prevalence survey link, but we really do need your help. I want to thank Gray Muzzle again for bringing this issue to light. This is not always the most fun topic to talk about, but it is really important. And the fact that you're watching this, whenever you're watching this, wherever you're watching it, tells me that you have an interest in prolonging the health and longevity of your dog. And that makes me very, very happy. So again, on behalf of Gray Muzzle and the Association for Pet Obesity Prevention, thank you so much for your time and attention. And we can take a couple of questions if we have any.
I don't know if you can see, there's two questions in the question and answer box. Do you want me to read them, or do you want to read them?
Yeah, if you can read them. Yep, I've got the chat up, but I don't have the Q&A.
Yeah, sure. So the first question says, how many pet owners of overweight pets are overweight themselves?
Yeah, I get that question asked a lot, and I say it's irrelevant because there's not a causality, and I think that sort of loses the real interest and importance of the dog's state, right? And it's sort of like I do a lot of work with childhood pediatric obesity, and they've also kind of looked at that same topic. And at the end of the day, it's like, what are you trying to do? If there was a direct causality, then I would say sure. And there are people that can make corollaries. Oh, if the parent or the pet parent has unhealthy habits, then they're going to transfer that to their by proxy, to their child or the dog or cat under their care. And I'm like, okay, that's great, but we might be shooting the messenger a bit there, and I don't see how it helps me as a veterinarian. So we have really kind of held back on doing that kind of research because the fact is, Dana, 67-68% of US adults are overweight or have obesity. So I would say already that's a biased sample, right? Because the majority coming in. So if I say, well, gosh, how many of the dogs and cats that I see, I mean, you can already see how it's going to, well, if 2/3 are already having this issue. So for me, I see them as discrete, separate. I don't really see the value to me as a veterinarian trying to help a dog lose weight to reach a healthy body condition of that. Having said that, obviously this is a massive problem. I've been, honored to participate with the CDC, at several events. We do view this as a One Health issue. And so we know that these issues are broad. Having said that, what I view the biggest value of dogs and cats to this One Health part is the fact that they are sentinels. And so if you go back and look at when I was writing, in 2008, 2007 about plastics, microplastics, bisphenol A, BPA, and endocrine disruptors, right? When I was saying, look, guys, there's some evidence here that this might be a problem. And we were looking at animal models. And so for us, I view our dogs and cats, again, as if I'm seeing a problem in a dog or cat, does that in any way relate back translationally in a One Health fashion to the human caretaker? But I love the question. I think there's value to it. I just think that from my perspective and my interest, I'm not really interested in, I'm not going to blame the pet parent's condition on the dog. I'm here to help the dog. I hope that answered.
Okay, and then the next question is, are there any particular breeds that you find to be more susceptible than others or less
Yeah.
susceptible?
Yeah, great question. And I'll tell you, we've got to transcend the breed predisposition. It's genetics, right? And so there are several genes that we've identified. The biggest is the POMC gene, okay, but there's also AME2B, and I mean there are several that we're looking at in interest. In fact, there's an Israeli researcher who's doing some phenomenal work right now on looking at different markers, genetic markers. So I think we have to say, okay, we see clusters of breeds, but more importantly, what about the genetic makeup? And so you can actually have your dog's genome sequenced. There are several companies out there that do it. I mean, you can order these tests online, and they all track, especially for POMC. And POMC has been associated with food drive. And so at first, everybody said, oh, this is the lab gene. Well, let me tell you, as soon as we started looking at bigger data sets, we realized, holy smokes, a whole lot of dogs have multiple copies of the POMC gene. And the more copies you have of this genetic mutation, the more you are affected by this condition, the more food drive, which again means that the dog's relationship with food is different than one without multiple copies of this mutation. So I think we need to think in terms of genetics, not breed, although breed's a good placeholder for now. But I think the problem with saying, oh, these dog breeds are at risk, well, then we sort of say, well, that dog is not. And that's just not true at all. This is simple genetics, and so this mutation is abundant throughout canids. And in fact, it's one of the reasons why we domesticated them in the first place, because dogs with this POMC mutation were more trainable. Okay. And then we reinforce that within breeds by breeding those dogs that were easily trained. And so now, of course, we have a whole generation of dogs out there that have, this mutation that aren't doing any work. So it's fascinating. Let's move beyond breed predisposition and look at genetics and look at the individual. And so again, I would definitely encourage you to have your dog. In fact, that's one of the things we do with most of the obesity patients is we say, hey, if you're able to, spend $100, get one of these genetic tests. Let's just look at the markers. And sadly, most of them have these mutations that we're looking for.
So there's no other additional questions from our audience members, but I actually have a question myself. So I know that you talked about, in general, each dog has to look at their own individualized whole picture, and that includes exercise, food, and a couple of other factors. But my question specifically related to food is, when you start putting together the plan, do you recommend that whatever the dogs are eating, that they keep to that same food and just do the reduction? Or do you have like a certain, specifically to the macros, do you have a certain program that you say, try to find something within these macros first, and then we'll make adjustments with food later if we need to?
Yeah, absolutely. And so whenever a dog comes to me and they have overweight or obesity, and I'm trying to help them lose body fat, my initial approach nutritionally is always going to be with a high protein, high fiber, right? And typically most of the foods that they're eating probably aren't as high in protein as I would like. So we're talking kind of north of 35%, crude protein. So we're really, we're already jumping up into that next level of high protein. And the reason we're doing that is try to optimize lean muscle mass preservation. So we know that we've got to, if we just cut calories, again, we're going to be cutting protein. So if we just take whatever you're feeding and knock it down 10%, we just knocked off 10% of the protein, which is not going to support lean muscle mass preservation. So that's one of the main reasons I do it. Either the fiber, I like the high fiber, and there are a couple of companies that have done really great work. It is very complicated to produce a food with high protein and high fiber. They just don't mix well together, literally, into a dry food, and certainly not into a wet or canned formulation. So when I look at the high fiber, that's going to do several things. Number one, it's going to help us with insulin. We kept talking about insulin and insulin resistance and beta receptors and alpha, all that stuff, right? So fiber is my friend when it comes to that. It's also going to maybe make some adjustments to the microbiome, which is another important influencer in the obesity equation. And more importantly, it's also going to add to satiety. So high protein and high fiber do make a dog feel fuller. And so those are kind of my first thing. And then, I'll have that dog that comes in 3 months, owner's doing everything exactly exactly as I've prescribed and we're not getting results, then I'm going to flip the equation. I'm going to try a low protein, low fiber, maybe not a low fiber, but certainly a lower fiber whenever possible. I'm going to try to go in as far of a direction as I can possibly. And I usually play with proteins the most. Now, the danger with dropping that protein is, again, we do risk preserving lean muscle mass, which is really what happens with a lot of weight loss programs, both for humans and dogs and cats. So basically, they lose the fat, but they're also losing a disproportionate amount of lean muscle mass. And so that's not healthy either.
Yeah. Thank you
Great
for that.
question.
And I think the last question, which basically kind of correlates with what you were just saying, and I think we already probably know your answer, but they're specifically asking if you find any preference or difference in results, whether a dog is on like a kibble versus maybe a raw food, or incorporating like natural elements into their diets.
Yeah, I don't. And that's just because it's all about the nutrients, right? Not ingredients and processing. It's actually about the nutrients. And so the calories there are really what we're going to be juggling. And so, I'm very open-minded with these different approaches, right? I mean, they're very few, unless it's not a complete imbalanced formulation, right? Whether it's home prepared, raw, whatever, fresh, you name it. As long as it's complete and balanced, I'm a fan, right? And then I'm going to play with the macros as we're allowed, as we're able to, depending on what you've got there. I do think that people, though, have to be open-minded. So I do run into a fair number of folks that are dogmatic in their approach. They say, well, this is the only thing I'm going to feed. And it's like, but we won't be able to manipulate the macros the way we need to get to that result. And I'm not saying you can't lose weight in some of those situations, but you're not going to lose it as safely and effectively. And so, I would also encourage you not to be so dogmatic about it and be open-minded. And remember that this is not necessarily for life. It's like I was talking to a pet owner not too long ago, and she had a very strong opinion on a certain way of feeding. Okay. So, and it was not anything that I could give her or she couldn't order on Chewy, right? So I'm going to leave it at that. She had a very strong opinion. And I said, listen, I totally respect, your belief, but let me ask you this. If your dog had cancer right now, and I said, listen, for the next 6 months, we're going to recommend a chemotherapeutic regimen, right? So we're going to do a variety of drugs. We're going to try different things to try to reduce the tumor load here, right? Would that be something you would do? She said, well, of course, I would do anything to cure cancer or treat cancer in my dog. It's like, that's how I view this situation. It's short term, 6, 9, 12 months. We try a different food. We try this approach. And if we're not getting the results, then obviously you can abandon it any time. But if you'll go on this journey for this period of time, once we then correct it to a healthy body composition, then you can go back to what you were doing. We're going to probably make sure we do the calories a little more tightly, but and she did, and she got it. So I think that the other thing is that I don't want you to view this as forever. This is a period of time where we're treating a condition, and if we treat it successfully, then you're probably going to go back to doing something very different from this. And if we don't get the results we want, then at any time you're free to go. And that's sort of, again, I think that we need to be a lot more open to our approaches out there.
Right. Well, thank you so much. I appreciate everything that you shared with us today and for answering questions. It looks like the questions are complete. And that will wrap up our session for today.
Thank you guys so much. I love it. And again, support Gray Muzzle. They're doing amazing work.
Yeah. Well, thank you, everybody, so much. And again, thank you, Dr. Ward, for spending your time with us and sharing your expertise. We really appreciate it. Presentation was very helpful. And thank you to all of our supporters for continuing to help us save lives of senior dogs. We really appreciate it.
Thank you.
Thank you.